And welcome to Medical Dialogues. I'm Roshni. Let's look at today's top news. Government fee for 50% MBBS seats in private medical colleges. Supreme Court to examine validity of NMC fee order. The Supreme Court will now examine the validity of the NMC's fee order directing government medical college fees at 50% of the seats in the private medical colleges. The Supreme Court is set to hear a plea by the Association of Health Sciences Institutes challenging the NMC's directive dated February 3, 2022, stating that the fees for 50% of seats in the private medical colleges should match those of government medical colleges in each respective state and union territory. Earlier, various high courts had considered similar pleas, prompting the Supreme Court to allow the transfer petitions filed with the NMC to consolidate all related matters. This move was met with opposition from private medical college managements, arguing that it neglects the significant investments made in infrastructure. The Supreme Court is now scheduled to address the matter on March 22, 2024. Action against 4 doctors for turning away accident victim. The Health Department has taken disciplinary action against 4 doctors from 2 Delhi government-run hospitals, Lok Nayak Hospital and GTB Hospital, in connection with the death of a patient who was denied treatment. The patient, a 47-year-old man accused of sexual harassment, sustained injuries while attempting to escape from a police vehicle and later died after being denied treatment by 4 government hospitals. The Health Department has directed each hospital to terminate the services of a senior resident doctor who was on duty on the night of January 2nd and 3rd. Additionally, the department has recommended the suspension of 1 senior doctor from each hospital. The 4 doctors have been found guilty of negligence, and the administrative heads of both hospitals have been instructed to provide explanations for the lapses. Health Minister Saurabh Bhardwaj sought an explanation from 3 Delhi government-run hospitals, that is JPC Hospital, GTB and Lok Nayak Hospital, that denied treatment to the accused. The 4th hospital involved, Ram Manohar Lohia Hospital, is under the centre's administration. Preliminary findings suggest that JPC Hospital did not have lapses, as they attended to the patient, stabilized him and referred him to another hospital. The FDA warned an asthma drug could induce despair. Many were never told. In 2020, the FDA issued a stark warning about the asthma and allergy drug Singulair, indicating potential side effects such as aggression and suicidal thoughts. However, the warning had limited impact, as the drug was still prescribed to 12 million people in the United States in 2022. Children who face higher risk continued to use the drug, with 1.6 million prescriptions. The FDA's handling of Singulair highlights gaps in addressing side effects from long-approved medications and in effectively warning the public and doctors. Despite issuing a warning label, the FDA did not mandate education for doctors regarding the drug side effects. Some patients only became aware of the risks through online support groups, emphasizing the need for improved communication about medication risks. Ozempic not linked to increase in suicidal thoughts, US study suggests. A recent US federal study funded by the National Institute of Health and conducted by Case Western Reserve University reveals that individuals taking the diabetes and obesity drugs Ozempic and Wegovy, containing the active ingredient semaglutide, had a lower risk of suicidal thoughts compared to those on other medications for the same conditions. The analysis involved electronic medical records of over 1.8 million patients prescribed semaglutide or alternative drugs for obesity or diabetes between 2017 and 2022. Individuals on semaglutide exhibited a 49% to 73% lower risk of first-time or reoccurring suicidal thoughts during a 6-month follow-up period. The study focus was on patients taking semaglutide or other drugs for diabetes or obesity. This research follows reports prompting European and US regulators to investigate anecdotal cases associating semaglutide with thoughts of self-harm. While the study indicated a lower risk of suicidal thoughts, it did not address whether GLP-1 drugs like semaglutide reduce overall suicidal thoughts. The study authors urged closer scrutiny of reports linking suicidal thoughts to these drugs and recommended extended follow-up periods for patients. The investigation was prompted by the European Medicines Agency's review of approximately 150 reports of possible self-injury and suicidal thoughts related to GLP-1 receptor agonists, including semaglutide. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.